Hey everyone, as a physician who has cared for older adults for over 30 years, I want to share something that many people over 60 just don't hear clearly enough. Your leg strength is one of the single strongest predictors of how long you will stay independent. It's a fact. After you turn 60, your body naturally begins to lose up to 3% of its leg muscle every single year. Most people just shrugged and say, well, that's just aging. But the consequences are far more serious than you might think. A major 5-year study looked at nearly 2,000 adults over 60, and what they found was startling. Those who lost leg strength had a 287% higher chance of needing a walker or even a wheelchair within the next decade. That's a huge number. But here's the part that gives me real hope, and it's why I share this with every single patient I see. Scientists also discovered that just 3 simple exercises, when you do them correctly and consistently, can reverse up to 40% of age-related leg muscle loss in only 12 weeks. And get this, you don't need a gym, you don't need any special equipment. All you need is your own body and just a few minutes each day. In fact, one of these movements is now being prescribed by orthopedic surgeons at Johns Hopkins instead of knee surgery. The results are remarkable. Nearly 70% of those patients ended up canceling their surgeries after just 8 weeks because their pain disappeared and their strength improved so dramatically. So, my goal today is to walk you through these exact exercises, clearly and safely, just like I would guide a patient in my own clinic. We're going to do this together so you can rebuild your strength, protect your mobility, and stay active and independent for all the years to come. Let's get started. Let's start with a movement that looks simple but delivers remarkable results: the wall sit. I recommend this exercise to many of my patients over 60 because it strengthens the legs without putting any pressure on the knees, making it one of the safest and most effective movements you can do right at home. When you slide into a wall sit, you activate every major muscle in your lower body. We're talking about the quadriceps on the front of your thighs, the hamstrings behind your legs, the powerful glute muscles that keep you stable and upright, and even the small stabilizers around your knees that protect you from falls. What makes wall sit so valuable for older adults is that they build strength through something called isometric tension. This means your muscles are working intensely while your joints stay completely still. This protects aging knees while still stimulating real muscle growth. In fact, a study in the European Journal of Applied Physiology followed seniors over 60 who performed wall sits just 3 times per week. The results were astounding. In only 8 weeks, they increased their leg strength by 31%, and their balance improved by a massive 23%. That's a huge factor in preventing falls. So, how do you do it correctly? Here's how I teach it to my patients. First, stand with your back flat against a wall, with your feet about shoulder widths apart, and roughly 2 feet away from the wall. Before you even start moving, it's crucial to engage your core. Imagine someone is about to gently tap you in the stomach. Now, slowly slide down the wall until your thighs are parallel to the floor. If that's too difficult at first, don't worry. Just stop halfway and you can progress over time. The most important thing is to keep your knees directly above your ankles, not pushed forward. Make sure your entire back, especially your lower back, is pressed firmly into the wall. Now, hold this position for 20 seconds to start, and remember to breathe slowly through your nose, 4 seconds in and 4 seconds out. As you get stronger, try to increase your hold time by 5 seconds each week. Once you can comfortably hold the position for a full minute, you can add a little challenge. Try gently lifting one heel for 5 seconds, then switch to the other. This simple addition activates those deep stabilizer muscles that help prevent ankle rolls and stumbles. I have a 68-year-old patient who struggled with unsteady knees for years. She began doing wall sits every single morning. After just 6 weeks, she could stand up from chairs without using her hands to push off something she hadn't been able to do in over a decade. This movement might look simple, but it is one of the most powerful tools we have to rebuild leg strength safely and effectively. The second movement I encourage all my patients over 60 to practice is another simple but powerful one. It may look ordinary, but in the medical world, this movement is considered one of the most accurate predictors of whether someone will stay independent as they age. Rehabilitation centers across the US use step-ups as their gold standard test for leg function, and for good reason. This movement trains the exact muscles you rely on every single day to climb stairs, get out of a car, step off a curb, or regain your balance after a stumble. A major study from the University of Sydney tracked 420 adults over the age of 60. Their findings were remarkable. Seniors who could perform 15 step-ups without stopping had an 82% lower risk of mobility loss within the next 5 years. This tells us one thing very clearly: the ability to step up is directly connected to your long-term independence. So let's talk about how to perform step-ups correctly. Find a stable step that's about 6 to 8 inches high. A stair step, a small sturdy bench, or a solid platform will work perfectly. Stand tall with your feet about hip-width apart. Place your entire right foot firmly on the step hand. I mean the entire foot, heel included. This is so important because using your full foot activates 40% more muscle fibers. Now, press through your heel to lift your body up onto the step. A common mistake is pushing off with the back leg, but you want to avoid that. The working leg on the step should do all of the lifting. Then, lower yourself back down slowly, taking 3 full seconds to return to the starting position. This slow eccentric phase is where you really rebuild strength and protect your knees. Repeat this for 10 repetitions on the right leg, then switch to the left. As you grow stronger, you can increase the step height or add a gentle knee lift at the top of the movement. If balance is a concern, lightly touch a wall or a railing for support, but avoid leaning or pulling yourself up with your arms. Why does this exercise matter so much after 60? Step-ups are incredible for correcting muscle imbalances, strengthening the hips and knees, and improving the coordinated leg control that prevents falls. Many of my patients are surprised to discover that after just 4 to 6 weeks of doing these, stairs feel easier, walking becomes more confident, and that lingering knee pain starts to fade away. For the best results, perform step-ups every other day. This gives your muscles a chance to rest and rebuild stronger between sessions. Now for the most important movement of all, the one that orthopedic surgeons at Johns Hopkins are now prescribing instead of knee surgery for many patients. It's the single leg stand. It may look almost too simple to be effective, but balancing on one leg activates 73 different muscles, including all those tiny but critical ones responsible for hip stability, ankle control, and fall prevention. The science behind this is truly eye-opening. A 10-year study published in the British Medical Journal found something shocking. Adults over 60 who couldn't stand on one leg for 10 seconds had an 84% higher risk of death from any cause in the next decade. That's how closely your balance is linked to your longevity. So, how do you perform it safely and effectively? Stand next to a counter or a sturdy chair for safety. Lift one foot slightly off the ground, bending your knee to about a 45-degree angle. Now, here's a pro tip. Focus your eyes on one single point straight ahead. This simple trick can improve your balance by up to 40%. Try to hold this position for 30 seconds, then gently switch legs. Once that becomes easy, you can start adding progressions to challenge yourself. First, try doing it with your eyes closed. It's much harder than it sounds. Then, try slowly turning your head from left to right while balancing. And finally, you can try moving your raised leg forward and back. Each of these progressions strengthens your inner ear balance system and the small, deep muscles around your hips that are so vital for stability. I have a 72-year-old patient who started practicing single-leg stands 3 times a day. Within 2 months, her balance improved so much that she stopped using her cane entirely. These 3 exercises prove that you don't need a gym or fancy equipment to build a stronger, more resilient body. Give them a try, stay consistent, and you'll feel the difference. Thanks for watching, and don't forget to subscribe for more tips on staying healthy and active. Hello, I'm a physician who has worked with older adults for more than 3 decades, and I want to share a crucial message with you today. Strong legs are not a luxury. They are the very foundation of your independence. The most encouraging truth is that your legs can become stronger at any age, whether you're 60, 70, or even 80. What we see in real-world clinics confirms this again and again. Let me tell you about a study from a rehabilitation center in Boston. They tracked 200 seniors who committed to the exact 3 movements I'm about to show you. The results were nothing short of extraordinary. After just 3 months, 68% were able to climb stairs without even touching the railing. 74% reported that standing up from chairs became significantly easier. 43% saw their knee pain reduce or disappear entirely. And get this, many were able to cancel knee surgeries they once believed were unavoidable. Now, You might be thinking these improvements came from expensive machines or long grueling hours in the gym, but they didn't. They came from just 15 minutes, 3 times a week, using a simple, powerful sequence. First up is the wall sit. This move is fantastic for activating and warming up the large muscles in your legs. All you do is find a clear wall, lean your back against it, and slide down as if you're sitting in an invisible chair. Hold it for as long as feels comfortable. This prepares your muscles for the work ahead. Second is the step up. This is all about building real-world strength for daily life, climbing stairs, getting into a car, or navigating curbs. You can use a low, sturdy stool, or even the bottom step of a staircase. Step up with one foot, then the other, and then step back down. It directly translates to the movements you do every single day. Finally, we have the single leg stand. This is a game changer for sharpening your balance, preventing falls, and even strengthening your bone density. Simply stand near a wall or a sturdy chair for support, and lift one foot off the ground. Try to hold it for 10 to 30 seconds before switching legs. I often tell my patients, strong legs are the engine of healthy aging. Protect them, and they will protect you. If you follow this routine consistently, even with just 70% effort, you will begin to notice changes within 2 weeks. By week 6, most people feel a tangible difference every time they walk, stand, or climb a flight of stairs. And I want you to remember the most important part of this. You're not training for an athletic competition. You're training for your life. You're training for stability, for safety, and for freedom. So, start today. Start small. Stay consistent. Your future self, the one who still wants to travel, play with grandchildren, and live confidently and independently will thank you for it. Before you go, I want to leave you with this one last reminder. Your legs are your independence, and every small effort you make today protects the life you want to live tomorrow. If these movements helped you understand your body a little better, I'd like to ask you for one simple favor. Click that like button so more seniors can discover these evidence-based routines. Subscribe the Healthy Path channel for more weekly, doctor-guided exercises to protect your strength, mobility, and long-term independence. And please, share this video with someone you care about, a spouse, a parent, a friend, who deserves to feel steady and confident again. Remember, strong legs are not a gift of youth. They're the result of consistent care at any age. I'll be here every week to guide you on that journey. Thanks for watching.